So hi everyone. Today we'll be looking into surgical orthodontics, and we'll be covering about why, what, and when surgical orthodontics, and we'll be only looking into the minor surgeries. So the question always arises what, when, and why. So it basically determines when and why should you do or why should you have surgical intervention. So at an earlier onset, surgical orthodontics would be required if the patient has some sort of syndromes that has affected its normal growth, or if it's a severe skeletal discrepancy, we would have to wait for the patient's normal growth to complete. If not, early intervention would hinder the growth potential of the patient. So when you look at the minor surgeries that are usually there in orthodontics, the most common one that would come into your mind would be your normal extractions. So extractions are very common in orthodontics because orthodontics deals with a lot of arch length tooth size discrepancies. In order to correct them, we would have regular therapeutic interventions, which are extractions. So these extractions are determined by the changes that would be required and by looking at the amount of corrections that is required. So here you can have an all 4 extraction, an all 5 extraction. We can have a lower incisor extractions. So all these would come under therapeutic extractions. So when you look at extractions, they can be further divided into therapeutic, serial, and extraction of supernumerary. Serial extraction, as we know, they are interceptive methods where we are trying to avoid the escalation of the malocclusion that would come in the future by removing the tooth which is preventing the normal eruption of the permanent. So it is usually a CD4 or a DC4 type of pattern that are followed. So, other than these normal extraction, one of the surgical parts we look into is the surgical uncovering of an impacted teeth. So, the factors or the components part of the surgical uncovering are your location, evaluation of position, the space available, surgical excision, and bone remodeling, and orthodontic attachments placement. So when you look here, you have a lot of multiple supernumerary teeth, impacted teeth, all those are present. So these are, some of the rare cases that you would find where you have a lot of things to work with. So all this can be corrected by orthodontics. The most commonly encountered impactions in orthodontics is your canine impactions. Now, canine impactions can be either buccal, palatal, and in some cases they were very difficult to correct. So, example, this case, it's a very highly placed canine, and it will be difficult to track such a highly placed canine down. But we are in the age of digital dentistry, and we have our diagnosis aids have improved over time. And OPG no more is the gold standard. So, a CBCT would always help to identify the location of the impacted canine better. Also, this is just a graph which shows, as the height increases, the difficulty would also increase severely. So, we can compare it to a signal, traffic signal light, which shows green, yellow, and red. So the exposure, once it is done, you have two techniques. You can either have an open technique or a closed technique, which you can follow. It is simple, where in the open technique, you would create a window, and in a closed technique, you would elevate the flap, place the attachment on the impacted canine, and then close the flap again to track the canine through the soft tissue. So this here is, if you look at it, it is a closed technique where they have, it's not a closed technique, it's an apically positioned technique where they have elevated the flap and apically positioned the flap and track the canine through the flap. Right here, it's a closed technique, but they have given a tunnel it's a tunnel preparation which they have done. So when you look, what they have done is they have removed the bone covering the impacted canine and made a space through the bone through which the canine can move into occlusion. So commonly used orthodontic attachments are, your buttons, your eruption chains, your monkey chains, and then all of these would have another force component to track the canine. Next would be your frenectomy. Now, frenectomy is a very common. We all know how they are done and why they are done. A high frenal attachment would lead to a midline diastema, and the removal of this frenum during orthodontic treatment is mandatory to achieve stability of the orthodontic treatment. So, frenectomy, very common procedure. Now, there are two schools of thought. The orthodontic school thinks or favors the removal of the frenum after about 80 to 90% of the space closure in order to avoid scar formation. Next would be your corticotomy. Now, this is the process that is used to accelerate orthodontic tooth movement. It is a simple procedure that is done to reduce the bone thickness and increase the inflammatory activity that occurs, hence by increasing the rate of tooth movement. So some of the other techniques that are there are your piezo-scission, your micro osteoperforation and laser scission. Other than corticotomy, PAOO, that is periodontally accelerated osteogenic orthodontics, are also a viable alternative, but it is slightly more invasive. But it has its benefits because these are used in cases where you have reduced alveolar bone supports, where it also accelerates the tooth movement and also increases the bone alveolar bone support. Precision. So in cases of rotated teeth, when after these rotations are corrected, your transeptal fibers are stretched. So the rate or the percentage of relapse of rotated teeth are much higher. So in order to prevent these relapse, it is always better to have a circumferential fibrotomy done to reduce the relapse tendency. So these are some of the minor surgeries that are there in orthodontics. Thank you.